What an absolute pleasure. I was able to catch several of the seed stage pitches, and each one of them is just remarkably just so much on the money in terms of what's needed. All right. So let me bring on stage, really. I'd love to introduce our Voice of the Enterprise panel here. Today we have with us Claret Presley from Sutter Health, Ainsley MacLean from Kaiser Permanente, Mid-Atlantic, and Sue Merrigan, former Optum, currently at Evergreen Nephrology. So welcome. Delighted to have each of you join us today to represent the voice of the enterprise. And I thought, a good way for us to start would be really for each of you to take a moment, take a minute or two, and just share with the audience what your role is in your current organization and really what your responsibilities are as it comes to some of the topics we've been touching on here. And then we'll get into that during the conversation. So I'll start with you, Claret. Why don't you please
Hi, good afternoon, everyone. Claret Presley here, and I am a nurse executive for Sutter Health. I oversee procedural areas and surgical services. My healthcare background started from a very humble beginning. I was a housekeeper. I was a diet clerk, pharmacy tech, transporter, unit assistant. You could probably name all of the job classification in healthcare. I did all of those. And so transitioned to leadership, and I have overseen primary care services, which is really the family practice, pediatric, women's and children. And then now I'm in surgical services that sees pretty much all the multi-surgical subspecialties, in addition to urology, gynecology, all the way to the clinics and bridging some of those gaps as a leader. Thank you.
Thank you, Claret. Awesome. Ainsley, why don't you please introduce yourself?
So much, Savitha. Thanks, Claret. I'm Ainsley MacLean. I'm a radiologist, practicing neuroradiologist by training, and I'm the Chief AI Officer at Kaiser Permanente within our Washington, D.C. region. So I have a deep fondness for all things technology and all things healthcare. And within Kaiser Permanente, I have a few other roles. I serve on our National Products Committee, where we negotiate for all of our large equipment nationally at an enterprise level. And I also serve on Kaiser Permanente Ventures, helping to kind of figure out what companies that we feel can really help promote the Kaiser Permanente mission of value-based care. So thank you so much. Looking forward to the conversation, Savitha.
Yeah, amazing. Thank you, Ainsley. And so last but not least, I mean, truly data is the backbone. It's the critical enabler for all things that we're talking about today. Why don't you please introduce yourself?
Thank you, Savitha. So I'm Sue Merrigan, and I'm the VP of Data and Interoperability here at Evergreen Nephrology. It's a startup. We partner with nephrology groups across the United States, and we do joint ventures with them, and we help them care for the chronically ill patients that have chronic kidney disease. My background is all data. My whole career, I've been in every industry other than finance, I think. I got into healthcare when I did a stint at Children's Hospital back in 2015 and stuck with it because I found the data so interesting and challenging that I never left. So here I am in, now a healthcare startup. So it's exciting.
Awesome. Thank you, Sue. So I wanted to maybe just frame today's conversation with a couple of facts, right? To lay out a couple of the market forces as it pertains to women's health. I think earlier in the day, we've all heard enough about how women's health is really an underfunded category when we look at digital health investments from the VC community. And just for reference, I've been tracking this space for almost 15 years now. And we can, it's even today, it's anywhere between 2.25% to maybe 8 or 10%, right? But regardless, the point is less than 10% of all venture capital investments in digital health are, going into this category of women's health. I wanted to add one more fact. I don't know how many of us have kind of followed this, but just about a year ago, this category has really, started to reach awareness at a level that I think we're finally going to see some shifts in the market. Just last year, President Biden had announced the first ever White House initiative on women's health research. And earlier this year, I'm particularly excited about the National Science Foundation's call for proposals, where they specifically were seeking proposals that looked at, research and engineering criteria, conditions that study how uniquely, differentially, or disproportionately the set of diseases that affect women's health, right? So I think the market is shifting. So with that, we really want to hear, and to our panelists here, I think as you all know, we have in the audience a mix of startup founders, investors, and other ecosystem participants in women's health. So I think the first question I'd like to just get everyone's perspective on is, in your respective roles, each of you has, in some shape or form, an innovation strategy or mission. You're charged, you're in your leadership roles, you have a strategy where in some shape or form, you're tracking where the innovation is happening, you're scouting the environment, you're figuring out what's out there, and you're trying to find ways to bring them into the enterprise. So how do you think about innovation overall in terms of how you execute on your strategy, and specifically when it pertains to women's health, right? And by the way, no answer is a bad answer, right? If the answer is, you know what, we've not even thought of women's health as a category. When I think of a big new initiative in my organization, that's perfectly fine. I think that's really what we want to understand a little bit better here. So does anybody want to go first?
I'm happy to go first.
Please.
Sure, Savitha, thank you. So, our focus is really on getting that 360 view of a patient, whether that be a woman or a man. Unfortunately, the hard truth is we don't focus just on women. We really focus on people with kidney disease, but it's very applicable. So getting all the possible data that we can get on a patient is really our focus to be able to fulfill our strategy of having them live healthier lives and keeping them from progressing to a later state. So we go with the qualified health information networks to get data. We go to all our joint ventures. We're getting all the EMR data. We got the payers. We're getting all the payer data, health information exchanges to get admit discharge transfer data. So really our focus and strategy is let's get every piece of information we can on that patient. So we have all of the data elements that we need to be able to do analysis and improve their health.
Yeah, and that's foundational. Thank you, Sue. Let's come back to that in a moment after getting everyone's perspective. Ainsley, how do you think about women's health or in the context of your innovation strategy?
The statistics you gave, Savitha, are sobering, and I do think they're improving slightly. I think it really starts in the C-suite and at senior leadership levels, and needing women who are positioned there, who are thinking strategically about, all aspects of company performance, but can shine that really important spotlight on women's health. At the Mid-Atlantic Permanente Medical Group within Kaiser Permanente, we have 60% of our senior leaders are women. And I think it really does make a difference. And I know for me, when I'm looking within the innovative pillars, I'm always kind of keeping that vertical of women's health first and foremost. So I'll just give a small example. Breast cancer, for instance, screening mammography, and that's what Kaiser Permanente does best, really, is this value-based, evidence-based care. And if we have women living longer, healthier lives from breast cancer, which we do, we know women are the backbone of almost every family when it comes to healthcare decisions. So if we can keep women healthy, we can keep women happy and live long lives, the reality is everyone benefits from that. So I think that the most important thing is having conversations like this, but also having conversations like this when you're setting out, as you said, your operational goals and your operational plans for the year. And I think one of the things you and I talked about, I mentioned breast cancer, but of course, women's health, as Sue alluded to, is really across the spectrum of every disease. So I don't see it as a limiting factor. I see it as something where, every disease honestly seems to affect women pretty differently than it does men. It's oftentimes more common in women than it is in men for certain diseases. And then obviously there's some like reproductive health that affect only women. So I think it's important that we don't narrow down our strategy, but just make sure that we're shining a light through our research and innovation. And I'm really proud that Kaiser Permanente does do that.
Yeah, absolutely. Thank you, Ainsley. And we'll come back to that. I had a follow-up question, but let's go to you, Claret. I mean, first off, I want to remind the audience, I think we're really fortunate to have you represent kind of the nursing leadership's voice here for this discussion, because so often than not, in my experience over the last 10 years, we just don't have that voice represented at the table. So would love to hear from you, in your role at Sutter Health, how are you thinking about, your innovation initiatives, and does women's health, factor in that concern?
Yeah, I mean, I will piggyback with Ainsley here, right? It start with leadership. With us, we just recently have a new CEO. He's 2 years in, but I will say the transformational pieces of this organization has been in an accelerated. Warner Thomas, he's our CEO, and he has been really focused on rebranding and refresh mission vision. And so for us, there is that huge impetus from our leadership setting the expectation on where we as an organization are headed to. The biggest expectation, the question, are you all in? And these are the set expectations for us. And so we're doing it authentically. We are being inclusive. We're looking at every single angle of any and every, especially women's health. There's a huge advocacy. And as far as nurse executive, we also see it from, the patient's voice. We look at it from our workforce. Specifically for us right now, I work in surgical services. When we go into the landscape of our care, we're looking at, do we have providers within GYN, oncology, surgical, subspecialties? What does that look like? Do we have a backlog? If we have a backlog, what can we do to do due diligence on physician recruitment, preserving some of our physicians who are really embedded in innovation, such as robotic surgery? My oversight as well is in robotic surgery as within the system. And so there is a voice. I'm one of those biggest voice, and many of us are advocating for women's health. It's non-negotiable. So that's one of the biggest thing that I will say Sutter Health is doing. We're looking at preventative measure. We're looking at being inclusive. We're looking at our service population to make sure, one, we're serving our patients, but also what does our workforce looks like? We wanted to make sure that there is a reflection of our workforce as well and preserving them.
Awesome. Thank you, Claret. I think that's incredible. So I think we've established a few things here. If I kind of summarize what I heard from each of you, really at a higher level, it comes from the leadership. These messages, these strategic imperatives are laid out at the top. So you've all kind of underscored the importance of having a strategy that's endorsed by the leadership, that you have lots of conversation and advocacy in the organization. That's amazing. That's fantastic. Let me go to the other extreme here, and I'm going to kind of follow up on something that you said, Sue, and I've been in those shoes, and so I totally relate to what you're saying. Right, from your perspective, where you're at as kind of head of data at Evergreen and in your prior role at Optum, what you focus on is, let's make sure to capture all elements of the data from this, patient's longitudinal view, or we have different, names for that. But the point being, you're coming at it from, I don't want to say bottom up, but I'm going to say that, right? You're saying first order of business is, let me capture everything that I need to or can capture, and then I'll figure out what to do, right? So just curious. I mean, look at all the founders, incredible startups we saw at the Pitch Fest just now, right? How do you see, Sue and the others, your organizations, are you leveraging those data elements? Is there awareness that we need to slice and dice and look at this information, this data, from a women's health perspective? Or does that get subsumed in the specialty? How are you leveraging the data to actually, accelerate the progress in women's health, if you will? So I'm going to ask that of you.
Yeah. Yeah, both at Optum and here at Evergreen, we're not doing it from that women's perspective, but there is not any reason whatsoever why we could not, right? So if we wanted to look at everything that is based just on women's health, we could easily do that. And it's just not an initiative for Evergreen. It really is about their kidney disease and their progression and keeping them from progressing and doing the best possible care plans that we can for them. So that's why the data is so fundamental for us. We need to know, did they hit the hospital? Did they go to their dialysis? What are their social determinants of health? Do they have food insecurity? It just goes on, right? There's so many pieces of information. And I wouldn't say that we collect all the information and then start using it. Really, what we've done is we focused on piloting, rolling out, getting additional information, adding into those, those data sets into our analytics and our predictive analytics. So because collecting data, as you know, takes a long time.
Yeah. No, and thank you for sharing that perspective. And I think you and I chatted about this earlier as well. But Ainsley, I'm curious, right, from a Kaiser Permanente, for the scale and the reach that you have in your role, are there ways by which some of this data in the in the health record or other sources, is that being leveraged? Is that being considered as you think about, your end goal, which is really improved outcomes for your patients?
Absolutely. We're a very data-driven organization. I would say there's almost no decisions that are made without data. And we certainly, don't have a paucity of it. And I would say it would be very rare for us when we're looking at a specific disease not to break it down by, every segment that we can. And a lot of that goes back to just our focus on population health, but then also our focus on personalized health and social determinants of health. So recognizing that, the house you live in, the city you grow up in, and where you live is going to influence the way you respond, the way as a care delivery, we have to make sure we reach out to you and capture that. I think it also helps inform decisions that you make, right, around implementation of new initiatives. So do we need to do a research project to dig a little bit deeper? I know you'd mentioned earlier, Savitha, about innovation. And as we're looking at new innovations, particularly in the AI space or working with startups, one of the first things that I always kind of do is look at, well, how has this particular product been tested before? What population has it been applied to? So for instance, if we're looking at an AI algorithm, was it only tested, say, in a Northern European patient population, maybe because it's related to skin cancer? And then do we then need to make sure that we're shining that light, that diverse light? So women of color, women, period. And just, I think we more and more with healthcare, we're realizing that we have to take it down to that individual level because disease is really incredibly personal. So we always remain data driven in everything we do. And I think the other last piece I'll kind of close that question with is around our quality and our HEDIS metrics, which we're a national leader in that specific space. And so when you're looking at populations, like how you treat diabetes, I think it just gives you that extra level of granularity. And then what interventions we can do. For instance, maybe there's a new technology, some of which, maybe on this call that specifically is beneficial in women. But if we don't know we have a problem to begin with, how are we going to know that we have a solution to it?
So thank you for that. And I just have to share this one tidbit here. That's kind of, I think, really amazing. I think you're at the forefront of really considering for each of it, whether it's the specialty or whatever the case might be, considering the women's health aspect of it. How does it affect these specific populations? When I was just looking at how recent has femtech and kind of women's health, kind of come to mainstream, if you will, if we are willing to say that. Not until 2016. I mean, I know this is a strange example, but just female lab rats, female mice were mandated to be in NIH's research only in 2016. So I mean, look at where we are. It's this is in 10, until 10 years ago, even in the lab, even in the engineering space, our population samples were not representative. right?
Menstruation definitely interferes with scientific studies. I was actually out to dinner with a colleague in Southern California who works at a large research university out there, and they had just finished doing sort of the protocol for a trial. And she said, once again, it was all male laboratory rats because of menstruation and because theoretically the hormonal cycle,
Yeah.
so I always think of that with everything I eat, every medication I take. I'm like, wow, the influence of the hormonal cycle has not been studied, whatever this is. And I think we all know how we feel different every week of the month, and after that ends as well with menopause and beyond. So a lot more work needs to be done.
Totally. So, Claret, I'd love to hear from you. I mean, I really learned something, eye-opening from you the other day about kind of how the surgical service line operates, right? The peri-op and post-op and so on. Would love to get your perspective from your surgical service line perspective or broader, how you think about when you're looking at your innovation strategies, right? And the data associated with, are you considering women's health? How is that reflecting in your kind of day-to-day role?
Well, I'm going to answer it in two ways. There is a piece in which how are we tackling innovation, and then piggybacking on the women's health, right? But we are in healthcare, we are in hospitals, and as you know, hospitals, especially in the operating room, we live in those red lines, and we have so much sacred cow. We are probably the last person to try to, get socialized with some of these innovation. But at the same time, it's ironic because surgical services has one of the most, high-tech equipment, right? You talk about robot, you talk about C-arm, all of the different aspect of it, including AI. The influence piece is tremendous. So for us as leaders, for us who has credibility that came from the very humble beginning, it's very critical for us to partner with vendors, especially with people that are plugging in the innovation and technology, to make sure that we are embedding the end users. So we need to make sure that there is an influence phase in there, that my team have a growth mindset, and that we are welcoming the innovation piece, because that's the piece that is very critical as far as piloting some new items, new equipment, new supplies, and whatnot. One of the things that you and I talked about recently is one patient will have at least 50 to 70 touch point from the time that they call for an appointment or they book their appointment, a human touch point. From going to their primary care providers, getting to an e-consult, going into their subspecialties for surgery, all the way to my team and going back home. That's 50 to 70. That is so ridiculous and redundant, right? We call you 72 hours. So those are probably, I would say, patient-centered care. Those are the things that we are trying to solve to ensure we do use automation when they need to be used. And then we do the patient-centered care in which it's personalized to make sure that each patient is valued and respected that way as well. So as far as some of the KPIs and using some of those data, it's imperative for us in our organization to share those data so we can be more objective. Many times we're very, anecdotal, and that is not acceptable anymore. We need to make sure, we have the numbers, we have the data, we also have the actual action items that we are trying to implement.
Yeah, thank you, Claret. So, it all comes back to the data, right? The data we're collecting, the data we're slicing and dicing against for the outcomes that we're all looking to drive. Now, I know we are planning to kind of head out into the networking, but I'd like to kind of frame one other question and really ask each of you to share boldly, what your thoughts are. Again, you're all in, leadership positions in your organizations. And for our audience and panel here, what are some of the gaps, right, or shortcomings in the current, technology offering landscape as it pertains to women's health? And maybe we can, make it broader than that. Because, for example, I know, Ainsley, you're in that business of constantly vetting the landscape, looking at what's out there to serve the populations you serve and drive the outcomes. Claret, you do that from the surgical service line. Sue, you do that from kidney care perspective, right? So what would you like to leave our audience with, in terms of thinking as they, if you could share what you see as major gaps in terms of offerings that the market offers to support your strategies to drive improved outcomes, right, for our patients. Again, let's start with you, Sue. What are your thoughts on that?
All right. So for me, it's really around AI for correlating and summarizing data. So we have so much data out there, it's so vast. And if I think about our healthcare providers and they have limited time to really zero in on the patient because they're boom, 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 one patient after another. And if we had AI where we could take all of these correlation factors, right, correlate the data, bring in the factors, summarize that, put it in front of the provider when they come in to see the patient so that they can make really quick, sound decisions. Something might take months, but if they have the, AI correlation of those factors and having that information summarized before them, it could, be instant for them to see a pattern or recognize, an issue that they could address very quickly.
Thank you. I love it. I'm hearing that all the time in my conversations with various enterprises. So AI correlation, theme number one. How about you, Ainsley? What's top of mind for you?
I'm almost like, where to begin? There's so many opportunities. And I think, one of the things I think about in just thinking of the female experience, and a lot of it is around putting yourself in your own shoes. And if you could write healthcare, what would it look like? For instance, for us, a lot of it is how can we bring healthcare to you wherever you are through a virtual visit, through something that's automated where you're on the run and you could get, consume some information about menopause or about your child's conjunctivitis. So kind of building out this algorithm for how do we meet women where they are. And the reality is women are extremely busy and wear a lot of hats. So I'll give you guys just one more example, Savitha, is we provide instant screening mammogram results. And that came out of our radiologists just realizing that women can't wait more than like 60 minutes and wonder whether they have breast cancer. They have so much going on. So I think sky's the limit. I love the focus on the pregnancy journey and beyond. I think that there's so many opportunities there. We provide remote patient monitoring in that space, but I think it's really an understudied space. But I think there's just so many opportunities around the woman lens and that female experience, how you want to consume healthcare. And I think that chapter is still yet to be written. And I don't have the answers. So I'm hoping everyone on the call does.
All right. Closing thoughts, Claret. I think any one theme that you want to leave with the audience?
I would say a lot on patient access, right? With one, if we as women could think of an open table version of how to really streamline bookings for appointments for women, in which working women, and that's not a Monday to Friday type of schedule. We need to be able to cater to working women. We might have to create some sort of brunch type of scheduling availability, but for me, a more accessible appointment settings in which it is catered for women. So that's one thing. And then the other piece is really having embedded accessibility into some of the unconventional locations. Spa, you can go to, some of the lounges. That is really accessible.
Wherever you are, as Ainsley said.
Wherever you are. You can hit the Eiffel Tower and you walk that way, and there's, a couple of places to get some quick mammo or quick, whatever it need be, right? So I think that's it's access in some unconventional places that, hospital and clinics are no longer trending.
Yeah, very good. I want to thank our esteemed panelists here for your thoughts. Really appreciate the opportunity.